Hello everyone! Before we proceed with today's discussion, can you please guess what do these sign language mean? Again? This means good afternoon everyone. Today, we are going to discuss about learners with physical disability, specifically those students who suffer with speech impairment and multiple physical impairment. We are also going to talk about learners who are gifted and talented, which will focus on learners who excel in visual arts or visual spatial learners. So our objectives for today's discussion is that by the end of the lesson, students will be able to first define and describe different types of learners, including those with speech impairments, multiple physical impairments, and visual spatial giftedness. Second is to identify and apply inclusive teaching strategies that support students with diverse needs. And third is to demonstrate an understanding of classroom accommodations that promote equal learning opportunities. So, learners with physical disabilities are those students who suffer with inabilities which may affect in their learning. So, for today, we're going to talk about learners who have speech impairment. So, speech impairment, from the word itself, they are those students who are different from us normal people who can fluently speak. So, they suffer in speaking or conveying the words that they want to convey. So, a speech disorder is any condition that affects a person's ability to produce sounds that create words. It may include damage to muscles, nerves, and vocal structures which can cause it. So, to understand more or to fully understand speech impairment, let us discuss its type. So, first type is fluency disorders. These affect the flow and rhythm of speech, which may include stuttering and cluttering. So we are very familiar with the word stuttering, since it can also happen to us even though we do not really have speech impairment. So stuttering is interruptions in speech with repetitions, prolongations, or blocks of sounds. And cluttering, on the other hand, is rapid and irregular Cluttering is rapid and irregular speech that may be difficult to understand. So in other words, stuttering is slow with lots of interruptions, while cluttering is very fast talking. So to understand more about stuttering and cluttering, let me read to you a dialogue. So here we have a first dialogue. So I will read the dialogue instead of you reading it. So here we have Kira. Our class presentation is tomorrow. Are you guys ready? I think so. What about you, Ethan? I'm a bit nervous. I don't want to mess up. Hey, no worries. Take your time. We've got your back. Yeah, what you say is more important than how fast you say it. You've got this. Thanks, guys. That really helps. So, the speech impairment present in this dialogue is very good. It's stuttering. As we can see, Ethan is suffering from talking normally. So, he stutters. Another dialogue, I will present to you another dialogue, and you identify whether the impairment present in that dialogue is stuttering or cluttering. So we have it here. Let me read it to you. Hey Yaji, what's your topic for presentation? Oh yes, I'm talking about volcanoes and how they erupt in lava flows. Whoa, slow down Yaji, I didn't catch that. I was saying I'm talking about volcanoes and it's okay. Just take a breathe and go one word at a time. We want to hear what you have to say. Volcanoes, how they erupt, and lava. Got it! So as we can see here in the dialogue, the impairment or the speech impairment present is, of course, it's cluttering and stuttering. As we can see again, Yeji is talking very fast, but through her friend's comfort words, Yeji spoke normally at the end. Another type of speech impairment, we have the second type, is articulation disorders. This involves difficulty in forming speech sounds correctly. We have lisping and phonological disorders. So in lisping, they have difficulty pronouncing the S and Z words. Instead of pronouncing the S and Z words or Z sounds fluently, they may appear to be like th or th sound. So in Bisaya, it's called being yungit. So let's say the silly squirrel. While we speak it fluently, diba? The silly squirrel. But those people rather who suffer with lisping, they will say it the silly squirrel, the silly squirrel. While those people who have phonological disorder, they have the difficulty with sound patterns, such as replacing or omitting sounds in words. And then we have here the third type of speech impairment, which is the voice disorders. This affect the quality, pitch, or volume of speech. So we have here two, the dysphonia and aphonia. In dysphonia, it is a hoarse, strained, or breathy voice due to vocal cord issues. While in aphonia, it is a complete loss of voice, often due to vocal cord damage. So to understand about them, let us watch a video about those people who suffer with dysphonia.
I have the rare version, the AB or the abductor version. My vocal cords stay open rather than open and shut, and I sound breathy quite frequently. He saw a apple-shaped mystically crossed 50 or 60 steps in front of his sister Kathy's house.
The form of dystonia I have is abductor spasmodic dysphonia. He saw half a shape mystically crossed 50 or 60 steps in front of his sister Kathy's house.
I have AB and AD, and I also have tremor. So whatever you can possibly get as far as SD, I have it. Early one morning, a man and a woman were ambling along a 1 mile lane running near Rainy Island Avenue.
I have an adductor. Early one morning, a man and a woman were ambling along a 1 mile lane running near Rainy Island Avenue.
I have the AD form of dystonia. Early one evening, a man and a woman were rambling along a 1 mile lane running near Rainy Island Avenue.
I have adductor spasmodic dysphonia. I also have some paroxysmal dyskinesias. Paroxysmal means comes and goes. So I have some, and the dyskinesias are movements that I don't do on purpose. And some of my upper body, my arms, sometimes move around when I don't expect it, when I'm trying to speak. Early one morning, Early one morning, a man and a woman were ambling along a 1 mile lane running near Rainy Island Avenue.
I have the AD
form of spasmodic dysphonia plus a tremor component with it. Early one morning, a man and a woman were ambling along a 1-mile lane running near Rainy Island Avenue.
So, as we saw in the video, they are people who suffer with dysphonia. So, they have difficulty in speaking properly, where the way they speak may appear breathy, or something like really suffering. So, next we have here another type of speech impairment. As you may have observed, our speech impairment have been from simple speech impairment, from the correct way to, or the fluency, which includes stuttering and cluttering, and we are going to proceed with much more severe speech impairment. So we have here the fourth one is apraxia of speech, or AOS. It is a motor speech disorder where the brain has difficulty coordinating the movements needed for speech, leading to inconsistent error. And the fifth one is dysarthria. It is a neurological disorder where weak or damaged muscles affect speech clarity, often seen in conditions like cerebral palsy or after a stroke. Diba? As you may have observed in people who suffer with stroke, or who after a stroke, they have difficulty in speaking because their muscles here cannot adjust, or sometimes they have jaw lock, which may affect in the way they speak. And then here we will watch a video of a child who suffer with apraxia of speech.
This is all new this morning. Everything is new for first-time parents. That's why so many of them find themselves making sure their kids are hitting certain benchmarks. So when something seems off or different, it can be really scary. This morning, I'm introducing you to one family whose son struggled with speaking, and it became a search to find what he was dealing with and how to work with it.
I got blue. Oh my.
It looks like just a game of Candyland, but for 4-year-old Chase Pregetzer,
What is this? Candy?
Red.
Candyland, Candy Castle.
Candy Castle.
it's a great way to practice speaking. Chase was born with apraxia. It's a rare speech condition that makes it hard for him to physically say words.
So your brain tells your jaw, your lips, your tongue what to do to make the sound. Chase's had almost like a disconnect. So he knew what he wanted to say, but he couldn't actually get it out.
Chase's mom, Katie, says she and her husband started to see signs when Chase didn't meet some milestones as a baby.
Babbling like baba, mama, dada. Really simple, just 2 consonant sounds, but he wasn't doing any of it.
By the time he was 18 months, he started getting speech therapy.
Very good.
But it took years for the family to officially get the diagnosis of apraxia. Katie reached out to 7 News because it's a condition that isn't often talked about and can be scary for moms and dads when you're trying to figure out what might be wrong.
I was a first-time mom, and I didn't know what milestones he should be hitting and when he should be hitting them, so I'm listening to the doctor and friends, and it just felt like he was kind of falling behind.
The thing was, Chase was picking up on everything. Kids with apraxia don't have any cognitive issues. They just can't make their muscles say what they want to say.
Everything's intact except for that communication piece, the brain to the mouth muscles.
Lindsay Massour is a speech language pathologist who works with Chase.
Oh, beautiful.
She says that disconnect means kids with apraxia will have a hard time saying words and might say them differently each time.
So maybe you want to say the word dog and it's coming out like fog, and then the next time you try it's coming out like hog, and then the next time you try you're just saying ah.
She teaches Chase how to move his mouth to make different sounds. In this video, you can see him following her cues to say snowball.
Snowball.
Katie says Chase has made huge strides since he started therapy.
Apple guess me while I play one more round.
But apraxia isn't easy to diagnose, and it can take time to get an official diagnosis. So she wants to get the word out to more parents.
The more people know, the better. We feel really fortunate with how far he's come.
Are you seeing?
So I asked her for some common signs of apraxia, and you heard Katie say not babbling or talking, also poor imitation skills, and maybe your kids would get frustrated when they're trying to talk to you. And she says sometimes Chase would try to tell a story, then he would just put his head down because he was really defeated because no one could understand what he was saying. But with therapy, he has been able to make a lot of strides.
So now, let us proceed with the sixth speech impairment, which is mutism, which includes selective mutism and total mutism. So, selective mutism, it is a psychological condition where a person can speak but chooses not to in certain situations due to anxiety. So, they can speak properly, but due to anxiety, they refuse to speak and certain events that they do not want to speak to. So, kung kadusara sila ready mo speak, then that will be the only time that they will speak. And then we have the total mutism. It is a complete inability to speak, often due to neurological or physical conditions. So, they are what we called mute people or completely mute people. So an example of that is a movie or a Korean drama series, which is in Twinkling Watermelon. The girl there cannot speak or is a mute. So now let's discuss the causes of speech impairment. So there are multiple causes of speech impairment. It can maybe be due to brain damage, due to a stroke or head injury, muscle weakness, damaged vocal cords such as in the aphasia, and then a degenerative disease such as Huntington's disease, Parkinson's disease, or amyotrophic lateral sclerosis. So a degenerative disease is a disease that starts with simple or not really severe symptoms, but as time goes on, it becomes severe. So amyotrophic lateral sclerosis is a neurological degenerative disease. So another cause of speech impairment is dementia. Due to dementia, people suffer to speak properly. So it can also, other causes may also include cancer that affects the mouth or throat, autism, Down syndrome, and of course, hearing loss. So how do we diagnose students who have speech impairment? So even though we are not really doctors who are specified for that field, there are still ways to diagnose a student with speech impairment. So first is to become a speech language pathologist. So they are a healthcare professional who specializes in speech and language disorder. And then second is the Denver Articulation Screening Examination. So this test evaluates the clarity of a person's pronunciation. And then we have the Prosody Voice Screening Profile. So SLPs use this test to examine multiple aspect of a person's speech, including pitch, phrasing, speech pattern, and speaking volume. And then we also have Dynamic Evaluation of Motor Speech Skills, or DEMS, manual. It is a comprehensive guide for helping SLPs diagnose speech disorder. So how do we treat students or people with speech impairment? So first is target selection, second is contextual utilization, third is contrast therapy, fourth is oral motor therapy, and of course fifth we have ear devices, and then the last one is medication. So as a teacher, what are the teaching strategies that we must use to ensure that our students who suffer with speech impairment feel included inside the classroom? First is to help children with articulation disorders to learn proper production of speech sound. Second is to help children who stutter to speak more fluently. And third is assisting children with voice disorders to improve their voice quality. Another one is to assist individuals who have difficulty swallowing as a result of illness, surgery, stroke, or injury, and then evaluating, selecting, and developing augmentative and alternative communication system. We can also enhance communication effectiveness. So as teachers, we are not really professional in the field of treating people with speech impairments. All we can do to our students is to help them, be patient with them, and do the best that we can do on how to treat them equally as normal students. So now let us proceed with students who suffer with multiple physical impairment. So, multiple disabilities refer to a condition in which an individual has two or more disabilities that affect their physical, sensory, cognitive, or behavioral functioning. These disabilities may occur together from accidents or may result from an acquired injury or illness. So, they are those people who have two or more disabilities or who suffer with two or more disabilities. So far we've discussed students who have suffered only one disability, such as speech impairment, and then visual impairment and hearing impairment. So this time we are going to talk about students who suffer with multiple disabilities. So they maybe have visual impairment, at the same time they have speech impairment. So here we have types of multiple disabilities. Actually, there are multiple types of multiple disabilities, but we're only going to discuss some as it may take some time. So first we have those students or people who suffer with cerebral palsy and visual impairment. So cerebral palsy and visual impairment have already been discussed, so this will just serve as a review. So cerebral palsy is a neurological disorder that affects movement, muscle tone, and coordination due to brain damage before, during, or shortly after birth, while visual impairment is a condition that affects a person's ability to see, ranging from partial vision loss to total blindness. And then we also have those persons who suffer with autism spectrum disorder and speech language impairment. So we have already discussed the speech language impairment. So what is autism spectrum disorder? So it is a developmental condition that affects communication, social interaction, and behavior, while speech language impairment is a difficulty in producing or understanding speech. Then we also have traumatic brain injury and paralysis. Traumatic brain injury is a brain injury caused by a sudden impact, blow, or trauma leading to cognitive, emotional, and physical impairment. So it commonly happens in accidents, while paralysis is the loss of muscle function in a part of the body due to nerve damage. So these two can be seen in persons who have suffered accidents or like very severe accidents. And then fourth one is those who suffer with Down syndrome and heart disease. So Down syndrome is a genetic condition caused by an extra copy of chromosome 21, leading to intellectual disabilities, developmental delays, and distinct facial features, while heart defects are congenital abnormalities in the structure of the heart that can affect blood flow and may require medical intervention. We also have those people who suffer with muscular dystrophy and learning disabilities. So muscular dystrophy is a genetic disorder that causes progressive muscle weakness and degeneration over time, while learning disability is a neurological condition that affects a person's ability to acquire, process, or retain information, impacting skills like reading, writing, or problem solving. So they are very luujud, those people who suffer with multiple physical disabilities, because they do not only suffer from one disease but two or more. So here we have a video of a child who suffer with multiple physical disabilities. So let us watch it now.
Thanks for staying. You're still watching Midday Live, and let's look at some more stories here. We look at one of our headline stories, and he has not had the benefits of education over a decade due to his multiple disabilities. Sebastian Ekube's condition has deteriorated over the years and has affected his cognitive and social development. Here's a report by Joycelyn Wood.
UNICEF estimates that 90% of children with disability in developing countries are denied access to education simply because of basic impairment. And 14-year-old Sebastian Ekwaba, who cannot walk and is hearing impaired, is no exception. His auntie, Diana Ekwaba, says just when the family was coming to terms with Sebastian's hearing impairment, there was another setback. He could still not walk at age 3. That was when they started seeking medical and spiritual help.
We have been to several specialists at Kolebu and 37 hospitals. all to no avail. We also went to several prayer camps.
However, his condition remained unchanged, thus they had no option but to enroll him in a special school, but all efforts to get admission to the Mampon School for the Deaf proved futile.
Authorities at the Mampon School for the Deaf say the child would be a burden if he is admitted because of his multiple disability. We have also written several letters to the Medina Social Welfare.
Another relative expressed concern about the development.
What the child will eat is a problem. The mother too don't have money. So I can see that the child is really suffering. So we are begging people if you can support him to go to school.
They called on the Ministry of Gender and Social Protection and other relevant stakeholders to help him gain access to good quality education. Although Ghana has a policy on inclusive education, children with disability and special needs still encounter challenges in accessing quality education. For now, government must demonstrate commitment to the policy by creating an enabling environment to address the diverse educational needs of Ghanaians.
So it is really Luoy, the child there in the video is really Luoy. She is suffering with multiple physical disabilities. She is paralyzed at the same time. She also suffers with hearing impairment. So before we proceed with the discussion of teaching strategies on students with multiple physical disabilities, let us first have the causes of multiple physical disabilities. So the causes may include genetic factors, environmental factors such as accidents or anything, and birth injuries. We also have the premature birth and traumatic brain injuries. So diagnosis of multiple disabilities may include screening processes, comprehensive assessment, developmental evaluations, genetic testing, imaging testings, and its treatment may include early intervention, assistive technology, medications, behavioral therapy, education and training, and support services. So the teaching strategies that we can use to students who suffer with multiple physical disabilities is to first use multisensory teaching, provide hands-on learning experiences, so break down tasks into smaller steps since they are disabled, so we need to break down tasks into smaller steps one by one. And then use visual support, and then use positive reinforcement. So let's encourage them to learn more, to think that the disability is not a hindrance to their success as students or to their learning. So we can also have individualized instruction, provide repetition and practice. So before I proceed to discuss about learners who are gifted and talented, I have a song for you, and then I'm gonna do it, and then you're gonna repeat after me. I'm gonna do it, and then you're gonna do it together with me. So we have here. Every single cell in my body is happy. Every single cell in my body is well. Every single cell in my body is happy. Every single cell in my body is well. Thank you, Lord, I feel so good. Every single cell in my body is well. Again, let's do it together. Every single cell in my body is happy. Every single cell in my body is well. Every single cell in my body is happy. Every single cell in my body is well. Thank you, Lord, I feel so good. Every single cell in my body is well. Very good. So now let us proceed with a discussion about learners who are gifted and talented. So they are those learners who are genius or who are talented. So there are 8 multiple intelligence according to Howard Gardner. So what, can you please give me one of them? Of course, we have visual spatial intelligence. So today we are going to talk about learners who excel in visual arts. So, what is visual spatial thinking? So, visual spatial thinking is the ability to perceive the visual information in the environment, to represent it internally, to integrate it with other senses and experience, to derive meaning and understanding, and to perform manipulations and transformations under those perceptions. It is the first language of the brain. So, an example of a person who is a visual spatial thinker, we have Gwen Beltran. So during our Proof Ed 7 discussion, diba, we were tasked to have a multiple intelligence test, and Gwen ranked 1, or his ranked 1 is visual spatial intelligence. So what are the traits of visual spatial learners? First, they like to draw. They like art, they like sculpture and painting. They're also good at directions, good at reading map, and can visualize or imagine vividly. They can also remember in pictures, or they have photographic memory. They also appreciate color and mostly uses metaphor. So they are people who excel at reading maps, playing chess, drawing diagrams, and illustrating illustrations. They also excel in repairing machinery, understanding geometry, and completing jigsaw puzzles are what we call spatially. So what are the teaching strategies to use to those learners who excel in visual spatial? So we use visual aids, of course. We encourage hand-on and spatial activities such as drawing. Do you know that activity where there is a circle and then the teacher says this is not a circle, this is, and the student will create an art. So that is one of the example activity which we can give to students who excel in visual arts. And we can also integrate technology and multimedia. We can also allow for creative expression, use movement and spatial learning, and provide alternative assessment methods for those students. And then, to summarize all our discussion for today, in summary, this lesson explores learners with disabilities such as speech impairment and multiple physical impairment by examining the causes, diagnosis, treatment, and teaching strategies for students with disabilities. Speech impairments affect communication and may require speech therapy, alternative communication methods, and classroom accommodations, while multiple physical impairments can impact mobility and daily activities, often requiring assistive technology and adaptive teaching approach. The lesson also discusses visual spatial gifted learners, focusing on their unique traits such as strong spatial recognition or reasoning and visual thinking, as well as effective teaching strategies like using diagrams, 3D models, and hands-on learning activities. By understanding the challenges and strengths of these learners, educators can implement inclusive teaching methods that foster a supportive and accessible learning environment for all students. Thank you everyone for listening. So here are my references, and have a good afternoon. Bye!